we look at the next slide, here's another map. Again, it's impossible to read this. We had no intention to do it. But the fact is every tooth is connected to some aspect of the physiology. So basically, as the tooth is living its life, and the quality of that living of life, whether it's there or not in the extreme, and if it's there, does it have a cavity, does it have a root problem, is it in balance, is there inflammation or something like that, all these elements are going to be taken into account in its relationship to the rest of the body, based on its specific mapping, okay?
So you can imagine if people that wear dentures, or they start to have their teeth pulled out, all that connection is basically getting a little garbled, to say the least.
Yeah, probably. Here's another one, showing different teeth related to different aspects of physiology. There's a meridian chart that gets into acupuncture and Chinese medicine.
This is a great chart. If you go onto Google and just do a search, they have it. So if you click on that tooth, then what it brings up, it tells you, okay, the 8 first incisors are topped right in the organs. It tells you which ones it's connected to. And you have to remember, until we started making these products, we never really looked into this. But it was really interesting because I found the tooth organ chart. This was probably a year and a half ago. And someone had just told me that my spleen needed some attention. And I looked at the tooth organ chart, and right where I had to have a tooth pulled out in the back, and it was connected to the spleen, which I thought was pretty interesting.
Tooth muscle chart, dental kinesiology. So if you've got a little muscle thing happening, then it's connected to teeth as well.
Yes?
I just wanted to ask one thing before you continue. Could you talk a little bit about the bone, gum recession, bone recession?
Right. Basically, once you have inflammation, then the gums, that's where it gets inflamed. They recede, then the dentin gets enamored by its own lack of protection. And then once the gums pull away, then the bone pulls away. Good. So we're going to talk about aging in general, and everybody wants to age well. Anybody here have another opinion?
There's no getting around it. Even when you're in the womb, you're aging. So
yeah.
we always think of it as something negative, but it's always happening.
Right. You just want to take best advantage of it and age the way nature had designed us to age, which was very gracefully and very fully, and not ignore who we are and what we need at any one time. Unfortunately, more research documents what we all experience, and that is that the majority of people, we just experience life as a progressive disconnect. We want to prevent this disconnect. All right. Now, the synapse is usually the form in the brain of a connection, but as you lose synapses, you also get disconnected. So you want to make sure that you maintain a robust level of synapses and the connection of your brain with your other organs, in particular your oral cavity. There is a lot of knowledge out there that most people just don't care about or read, but the people who do this, periodontologists, they have a lot of research, and they've shown that it's related to inflammatory conditions. So in other words, if there's diabetes, cardiovascular disease, Alzheimer's, your mouth is a contributing, if not an incidental phenomena to it. So the way your body reacts, because there's a general theory now in medicine that we have whole body inflammation, and it expresses itself a certain way with the liver, or a certain way with the cardiovascular system, a certain way with the brain, but whole body inflammation is mirrored by the inflammation in your mouth as well. And so what you see in the mouth is probably indicative of what you have in the body as well. Not necessarily, but most likely. This is a summary. If you take care of the mouth inflammation, the rest of the body gets better. We have some summary slides of that. So we want to reconnect, and we want to use procedures that will reduce inflammation in the mouth. And inflammation comes from what? How does your mouth get inflamed besides drinking gasoline and things like that? Okay? Your mouth gets inflamed by the improper diet, improper hygiene, leading to bacterial and tartar buildup. Okay? That's usually almost always the case. Bacterial tartar buildup, you get inflammation of the gums, and then it's a vicious cycle. And that's why people go to the dentist every few months. With older people, sometimes go every 3 to 6 months, and they get chipped away all the tartar. I mean, if a toothpaste worked, there should be no reason to get stuff chipped off your teeth. In fact, some of the newer toothpastes have chemicals, not so good, toxic chemicals, that actually prevent bacterial growth in your mouth. They've added that to the toothpaste and they think it's good, but it's still a toxin. But the point is that if you can stop bacterial growth and do a good job of cleaning and flossing, you can remove most of the bacterial and tartar and therefore the major source of inflammation and then recession and so forth.
How many people here think they have gum disease, gum recession?
Okay, how many people here are perfect? If you don't floss right as well, they get chewed away and recede. And as a result of that, the bone is going to recede. And what happens, you expose the dentin. And it's not a good thing because the dentin is not supposed to be exposed. If it was, it would have been born that way. Okay? So this is the problem. You have plaque tartar buildup, you have gum recession, you have dentin exposure, and then bone loss. And under normal circumstances, there's nothing you can do about it. Now this chart's a little hard to read, but there are 4 steps. On the upper left is a healthy situation. And then what happens when you get early stages of gum disease, you get that inflammation of the gums. Anybody experience this? You look in the mirror and you get this little red area in the gums. That means the gums are not happy, right? All right. Then what happens is that we get further accumulation of calculus and tartar, and that causes a little pocket. And the gums get even more inflamed because now you have more surface area around this toxic bacterial buildup. Bacteria is toxic. It's trying to kill everything around it so it can grow. Okay? And then finally, you have a severe recession, the dentin exposure, and then bone loss. So far, we've never found any competition out there. I mean, we have mouthwash, and we've gone to every store, the health food store, and you can find the Key 12 natural mouthwash. But they're nothing like our mouthwash, absolutely nothing at all. And there's nothing like our powders at all. So, and if you talk about our real kit for gum healing and for gum balancing, there's nothing on the marketplace. So we want to offer that to you tonight, but in the midst of this knowledge that there is an important role that your mouth plays in what you do besides speaking and eating, and that we want you to respect that, and we're going to offer you something to do about that to make it a very good mouth. Okay, so here's an example of cardiovascular disease. And what I want you to do is look at the dark line, the one in the middle, the blue line, because the red line and the green line just means that basically things are okay in your mouth. But if things are not okay in your mouth, then as you go from low to medium to high bacterial burden, then the problem is the walls of the blood vessels thicken. There's a reactivity. In other words, as the bacterial growth in your mouth become more and more and more, you find that the thickness of your blood vessels become more and more and more because you get a septicemia in your body and you start getting more inflammation. So there's a connection, some connection, exactly why we're not too sure, between the inflammation of your blood vessels and how thick they become and therefore hypertensive, and the inflammation in your mouth. The inflammation in your mouth, inflammation in your body are somehow connected. The correlation is there. And respiration as well. There's oral bacteria. You can breathe bacteria from your mouth down. And you can also get it through different chemicals that the bacteria are producing get absorbed in your blood. As you know, almost everything you put in your mouth can actually get absorbed into the mouth mucosa, into the capillaries in your mouth. That's why there's sublingual things. You put sublingual because it melts in your mouth and your mouth absorbs it. So your mouth actually absorbs a lot of things, and you can actually get a lot of things out of your blood into your mouth. You can measure many hormones in your saliva because the saliva has hormones that leak out from the blood. So we want to prevent this disconnect between how our physiology is working in our mouth and how our physiology is working elsewhere. Okay? And so oral health, oral inflammation leads to gingivitis, okay, which leads to periodontitis. Okay? In other words, the gingiva, the gums, and then the periodontic, right, the bone and so forth. Everything starts to get inflamed. Itis means inflammation. That's what itis means, just means inflammation. So you go toeitis, it means your toe's inflamed, okay? They don't actually say that, but that would work, okay? So basically, and out of that comes diabetic influence, cardiovascular influence, respiratory, osteoporosis, and so forth. And is there a solution?